understand the Meckel's diverticulum. This is the most important topic for any entrance examination. Okay, so most common encountered congenital anomaly of small intestine. In fact, it's the most common congenital anomaly of GI tract. Okay, this is MCQ. Okay, and the prevalence is 2%. Okay, and it is seen on anti-mesenteric border. Okay. And it is mainly present on 60 centimeter proximal to ileocecal valve. Okay. Okay, and this is the remnant of incomplete closure of omphalomesentiric or vitellointestinal duct. Okay, and it is equally in male and female. Okay. Okay. The usual manifestation is relatively wide mouth diverticulum measuring about 5 centimeter in length and diameter is around 2 centimeters. Okay, I will tell how to remember everything. Okay, I will tell rule of 2. Okay, the cell lining of vitelline duct are pluripotent. Okay, so most common cell lining is gastric mucosa. It is found around more than 50%. Okay, and the second one is pancreatic mucosa around 5. Okay, P for 5. Okay, and then less commonly is colonic mucosa. Okay, so most of the Meckel's diverticulum are benign. Okay, and incidentally discovered. Okay, so most common clinical presentation, if they are present, is a gastrointestinal bleeding. Okay, so hemorrhage is most common symptomatic presentation in children of 2 years of age. Okay, important line. Why there is bleeding? Because of chronic acid induced ulcer in the ileum adjacent to Meckel's diverticulum that contains gastric mucosa. Remember, the bleeding is not from the Meckel's diverticulum but adjacent, because this gastric mucosa is secreting the acid. Okay, and this cause the ulcer nearby diverticulum. Okay, so adjacent to Meckel's diverticulum. So next common presentation is intestinal obstruction. Okay, and if this obstruction is caused by, if the Meckel's diverticulum present in a inguinal hernia, it will known as Litter's hernia. Okay, litter hernia. Okay, remember Meckel's is little, so litter. Okay, so intussusception also can occur if a broad base diverticulum invaginate. Okay, so broad base. Okay, the patient will have same intussusception like feature, classic red current jelly stool. Okay, and palpable mass. Okay, so almost 20% of Meckel's diverticulum are symptomatic. Okay, okay, and the complication is more common in adult patient. Okay, okay. And when you suspect Meckel's diverticulum, when the appendix is found to be normal during exploration of suspected appendicitis. Okay, and the tumor, the neoplasm occurring in Meckel's diverticulum is most commonly is neuroendocrine tumor. Important MCQ. Okay, and then other one are adenocarcinoma, GIST, lymphoma. But at least one you should remember, the most common malignant neoplasm of Meckel's is neuroendocrine tumor. Okay, okay. Now it comes to investigation. Okay, so if the children is bleeding, so in children single most accurate diagnostic test is sodium 99 m technetium per technet scintigraphy. Okay, so it is a radionucleotide scan. Okay, remember this at least 99 m technetium per technet. Okay, so you can see in this picture persistent omphalomesentiric remnant. Okay, okay, and this is Meckel's diverticulum. Okay, diverticulum projecting from anti-mesenteric border. You can see this is side is mesentery and this is projecting from anti-mesenteric border. Okay, okay. in adult, the sensitivity of per technet scan falls because of decrease in presence of gastric mucosa. Okay, then how you can enhance the sensitivity of this per technet scan? By adding cimetidine. Okay, and cimetidine increase the sensitivity of scintigraphy by decreasing peptic secretion and while not affecting radionucleotide uptake. Okay, and release of per technet from the diverticular lumen. So remember, this cimetidine increase the sensitivity. Okay, so it will increase higher nucleotide concentration in the wall of diverticulum. Okay, so this is contrast radiograph showing the Meckel's diverticulum. Okay, this. Okay. Okay. Now come to treatment. Okay, if this is symptomatic means if the patient present with hemorrhage, okay, so you have to do segmental resection, because if you do diverticulectomy, the ulcer and the bleeding site is adjacent to diverticulum, not in the diverticulum. So if the patient present with hemorrhage, you have to do segmental small bowel resection. Okay, and if non-bleeding Meckel's diverticulum, then you have to do diverticulectomy. Okay, important. Asymptomatic diverticula found in children during laparotomy should be resected. Asymptomatic Meckel's diverticulum is bit controversial. Okay. So this is 99 m technetium per technet scan showing Meckel's diverticulum. Okay. Now comes to Meckel's diverticulum is hot spot for malignant disease. Okay, so better to remove the incidental Meckel's diverticulum. Okay, and the higher risk of complication, and so better to do resection in patient if younger than 50 years. Okay, younger, and male sex. Diverticulum length more than 2 centimeter. If ectopic tissue or palpable abnormality is present, better to resect. Okay. There are few more points in this Meckel's only given in some other part of the Sabiston. Okay, so I told you Meckel's diverticulum, most common congenital anomaly of the GI tract. Okay, and we have to see the most important, the rule of 2. Okay, so rule of 2 is 2% incidence, 2 type of heterotropic mucosa, actually 3, but you as a rule of 2 you can remember 2 type of heterotropic mucosa located within 2 feet of ileocecal valve, that is 60 centimeter, and 2-inch length, that is 5 centimeter in length. Okay, and symptomatic by 2 years of age. Okay, so this is failure of normal regression of vitellointestinal duct occur during this 5 to 7 week of gestation. Okay, and this is true diverticulum. Okay, contains all the layers of intestinal wall. Okay, and the most common presentation is painless massive lower GI bleed. All 3 words are important: painless, massive, lower GI bleed. Okay, and in younger than 5 years. Okay, so if ectopic gastric mucosa can also present in patient with intestinal duplication, one liner. Okay, so you have to do segmental ileal resection in bleeding if there is inflammation and ulceration. Okay, and you have to do end-to-end anastomosis. That is the gold standard. You can also do V-shaped diverticulectomy with transverse closure of the ileum. Okay, but you should remember this, at least segmental ileal resection with end-to-end anastomosis. Okay, here it is written asymptomatic Meckel's diverticulum should be left alone, but better you should go the first slide. Okay, let's see what is Bailey said apart from all this. So here it is rule of 2 is given. That's why I am showing. Okay, and 20% cases the mucosa Meckel's diverticulum contain heterotropic epithelium of gastric, colonic, and pancreatic type. Okay. Let's see what Schwartz says. Apart from all, they also tell Apart from all three, ectopic, gastric, and pancreatic and colonic mucosa, they have endometriosis and hepatobiliary tissue. And in rule of two, they said 2:1 male predominance. Okay, but Sabiston says it is equal prevalence. Okay. Then cause of intestinal obstruction associated with Meckel's. Okay, they have given mechanism. It can be due to volvulus, then mesodiverticular band, intussusception and stricture. These four can lead to obstruction. Remember this. Okay, and the intestinal obstruction is most common presentation in adults. Okay, this you should remember. So obstruction is more common in adult, bleeding is more common in children. Okay, and neoplasm is carcinoid, that is neuroendocrine tumor. Okay, if the patient is actively bleeding, you can go for angiography to locate. Okay, and this picture they are showing the mesodiverticular band. Okay, mesodiverticular band. This is the technetium scan. Okay, okay, and then I told you, segmental ileal section also necessary when it contains the tumor or if the base of the diverticulum is inflamed, perforated. Okay, okay. Thank you.